Hi there, everyone. Welcome to our webinar. I'm really glad you could join us this evening. My name is Martine, and I'll be your presenter this evening. I've been with Prospect Health for nearly 5 years now. I've presented various times at different universities around CV and interview tips, so hopefully you'll get a bit of information out of this. We've had some really great interest in the webinar, so I hope it lives up to all your expectations too. If there's anything you want to clarify on or want me to explain further, please add a question to the side panel of the webinar tool, and we'll answer all our questions at the end of the session. The webinar is supposed to be 30 minutes long, so hopefully we won't be keeping you too long tonight. So what we'll be talking to you about today. So first, I'll do a brief introduction to Prospect Health, and I'll also be introducing the veterinary consulting team. Then I'll tell you a bit more about what we do and how they can help us and how they can help you now and in the future. I'll then be going on to discuss interviews, especially I'll be focusing on competency-based interviews. Then I'll be discussing ideas of questions you can ask in interviews, practical tips for the interview, and finally we'll answer any questions that you have. And we have the whole vet team on the webinar tonight, so your questions could be about interviews or any general job-seeking questions can be asked too. So it's really not a problem. I should have clicked through this. So the competency-based interview question is all around the STAR method. And so I'll go into that in a bit more detail. So I just want to talk to you a bit about what service we can provide to you as a new grad vet. So many new grads will go into grad schemes, although we have successfully found roles for new graduates over the past 4 years. We can offer help and support throughout your career and point you in the right direction as to where you want to go. We really aim to try and keep in contact with you so that when you are ready to move from your first job, we'll be there to support you. We've just launched a new salary survey, which details salary surveys and salary expectations, of new graduates. So that's a really good one to have a look at. And also we offer loads of CV and interview advice and regular industry news and blogs via our social media pages and bi-weekly emails that we send out as well. So if you did sign up through our fall sponsorship, you would have hopefully been receiving emails from us as well so far. So first, I'll start off with competency-based interview. So what is a competency-based interview? So employers will be looking for a specific set of skills from the person they want to fill their role. These skills can normally be found in a job advert you'll be applying for, or if you're applying through an agency, your consultant will be able to fully prepare you for any skill requirements requested by the employer. These skills can be clinical or transferable skills. And by transferable skills, I mean the skills you adopt and learn throughout everyday life and work. These can be things like communication skills, time management, or organisational skills. Clinical skills are the skills you've learned at uni in order to actually become a vet. Luckily for you, I don't know if anyone has seen these, but the RCVS has shared the key competencies required from a newly qualified vet. Therefore, you'll be able to pretty safely surmise that these are the core competencies any employer will be looking at to see if you're making headway into delivering against them. I'm just going to flick off the presentation just for a little bit, and I'll take you to the download of the core competencies that you can find on the RCVS website. So you can see it here, all the day one competencies. And the interesting thing about them as well, so I think all I did was Google RCVS first year competencies, and they come up right there, RCVS year one competencies. I'm sure you've probably all seen these already. And it says here, a new graduate who has achieved A1 competencies will be capable and confident enough to practice veterinary medicine at a primary care level on their own, whilst knowing when it is appropriate to seek direction from more experienced colleagues. The interesting thing about it, though, is they actually do start with some more of the softer skills that you need to know as a vet as well. So communicating effectively with clients, preparing records, and working effectively as a member of a multidisciplinary team. So as you can see, it's not just about all those clinical skills that you've learned. A lot of it is also about the transferable skills as well that you will hopefully would have picked up. I'll just flip through these again. Right, so competency-based questions. So if you were faced with a competency-based question, what does one look like? You should really be able to identify a competency-based question by the words that it contains. So they're always like, can you give me an example of, describe a situation where you had to. They're really fairly open questions. and they probe and try and delve into your knowledge and ask you to give example situations where you demonstrated this competency, either in your work, university, or an everyday life scenario. So, what is the best method to use when answering these questions? So, that's why we're here tonight, really. I'm going to give you some top tips on what the best method to use is. And the best method by far that I've seen is called the STAR method. And if anyone has ever heard of this before, um, so the S stands for situation. So this gives you kind of a bit of a guide and how to plan the answers that you're going to for the questions that you're going to come across. So the situation is the first give the details of the situation you were in, which is going to demonstrate the required competency. T stands for task. This is what you completed in the situation. A stands for action. So this is what action you took to deliver the required competency. And R stands for result. By far and away, this is the most important bit and the most overlooked element of your answer. This is what is the outcome of the task? What was the result? What did you achieve? And what would you do better, if anything, next time around? So um, a lot of the time what people do when they're faced with a competency interview question, they'll give an example of a situation, but they won't actually conclude it saying, this is what I achieved, this is what I managed to do. And that's the kind of thing that the employer really wants to see. They want to see what you've learned and what learnings you've taken from it and how you would do better next time and how it's added to your toolkit to become a really great vet when you qualify. So what I did is I went through those RCVS competencies and I picked out a competency which is communicate effectively with clients, the lay public, professional colleagues and responsible authorities, listen effectively and respond sympathetically to clients and others using language in a form appropriate to the audience and the context. So firstly, you need to identify the competency you want to prepare for. And you need to really think about the type of questions you might be asked. So you can a lot of the time the competencies will be really clear on the job adverts. So I'm going to pretend that I'm going to prepare a question on communication skills, and the question is something like, can you give me an example of how you had used your communication skills to positively influence a situation? We're going to discuss how to prepare for a question on communication skills as a key competency. So the first thing I do is say, right, I'll pretend I'm Fred. I'm a final year vet student. And I'm going to write down all the activities that I've been involved in to date whilst I've been at university and also beyond. So I pretend I went to the RVC, so a student placement at the RVC University. I had a student placement at the Ipswich Vet Hospital, part-time vet assistant at the RSPCA. Also worked part-time at Sainsbury's, university treasurer of the Vet Society, and I'm also learning how to play the guitar. So I was a very busy vet student. I'm sure you probably all can't fit that much that much into your busy lives. So what I do as well is I'm a really visual person, so it really helps me to create a mind map of the different activities and how maybe I'll be able to answer a question on communication style with examples of these things. Some people may be happy to make a list, and please say it is okay to take this into the interview with you as long as you don't verbatim read, obviously, all the answers off your sheet. So here's my visual mind map. So from communication style, I can start putting down all the different things that I've been doing that I think might be pertinent to a question on communication style. So first, I'm going to think about, right, well, what's the situation I was in? So I'm going to start thinking about, well, when I was at the RSPCA hospital, during my time at uni, it was all about setting the scene, really. I'm going to say, I worked at the RSPCA hospital during my time at uni, as it fit in well in between my lectures and gave me exposure, of working with small animals in a charity setting, which is my passion. I thought it would be, I can't get my words out tonight. I thought it would also be useful to build relevant work experience in a busy vet hospital with a bustling dynamic team. So you're saying a bit about work flexibility. You're also trying to grow your business knowledge. So the task. So as a vet assistant, I often had to help handle small animals who are in a bad way, often with owners who are struggling to look after their pets. I once had a situation where an elderly man who had a dog which we identified as having ringworm with terrible crusty patches on his head, legs and paws, and it was in a terrible way, and the owner was very upset and distressed. So the task is what I was talking about and what you had to do in a day-to-day job, and how you use your communication skills to influence a certain situation. So what action did you take? So this is obviously how you use your communication skills to deal with that client. So you were patient and helpful, and I used my communication skills to talk to the man about the condition and how he could help treat his dog. To top it all off, the man was hard of hearing, so I had to be very clear and precise in my description of the treatment his dog needed. I had to enunciate all my words really clearly to ensure he understood, and I had to show him how to rub the cream the vet had recommended into the dog's skin to help the condition. So obviously she's working as a vet assistant at the moment, not as a vet. And then the results. So this is a really big thing. This is you actually showing um, what you learned from the whole situation. So the gentleman was incredibly appreciative of all my help and support. It really showed me how you need to adapt your communication style to fit in with his hearing needs and the needs of the pet. And then at the end, he also wrote a really nice letter to the practice manager thanking me for my help, which led to me getting a great customer service award from the team. So this is the most important part. What did you learn, and what did you achieve as a consequence? So to recap on these points, situation is all about setting the scene. Task, what did you do? Action, how did you go about identifying the competency the interviewer wanted to hear about? And then the result, what was the outcome? Don't forget the result, that is the most important bit. I think I've said that quite a few times now. So also I have so if you want help with competency-based interviews and you want ideas of there's another method in there. It's a bit more complicated. If you look at the sidebar, I've actually put a handout on there, which is a PDF all about answering competency-based interviews, and it's a booklet basically with all this information in it. Also, if you go and follow the link on here, you will see there is a Prospect Health newly qualified vet jobs competency-based interview guide. You can download the interview guide on there as well. So, if you don't manage to get through the whole STAR method and you maybe leave the interviewer wanting more, the interviewer is more than likely going to probe you for extra information to get the answer that he was looking for. So the best way to think about this is to think four bums on a seat. So we'll ask you why, when, who, where, and how questions. You'll definitely be asked questions which start with these words, which require a more detailed answer, and some examples to ensure you look like you know what you're talking about. So it's always good to prepare examples basically before you go into an interview. So also, what you've really got to think about as well is that when you go into an interview, um, it's not all about them interviewing you. It's you understanding what you want to get out of the job too. Remember, a job interview is a two-way process, and it's also about finding out, if this is really the place you would want to work. Have a really good think about what you want to get out of this first role and what you really want to learn more about. So some really good questions that the team came up with are, has the employee you're interviewing had experience with employing new grads previously? What are the success rates of their new grads? How many of this have stayed on in the practice? And can you talk to any about their experiences? It's always good to ask if you can talk to any people who are actually still there in the practice. How will cases be distributed? Will you get good exposure to surgery as well as consulting? I know as a new grad, sometimes you don't get that exposure to surgery that you really want. But you might have quite a lot of experience dealing with clients and pets, but you really want to get the exposure to surgery if you want to try and grow those skills. On call and out of hours, how much you expect to do. It's really good to clarify that before you actually start any job. And what support do you offer to new grads? So, are there mentors? Are there CPD courses you can go on? Do you get support to work up cases? If you are applying to a new grad scheme, find out the details about it. What are the internal CPD courses that you can go on? What is your yearly annual allowance of hours that you're allowed to use to go on CPD courses? Do they give you money towards going on external CPD courses as well? And clinical meetings at any on offer where you have the chance to discuss cases with more experienced staff to get help and advice. Remember, this is your opportunity to make sure that this is the company or the practice that you want to work with. So it's really important to get the most out of it for you, as well as the employer trying to understand if you're going to fit into the team as well. Non-verbal communication is also really, really key. So it's really important to dress appropriately and look smart. It's funny because I was talking to Chris about this the other day, and he was saying about someone who turned up to an interview after just painting their house, and they turned up in their uh, they turned up basically in all their clothes which were covered in paint and ripped jeans, and obviously they didn't get the job. So it's really important to take it seriously and dress appropriately and look smart for the situation. So what do you want to take with you? Take a copy of your CV, and do take any notes and prep with you. It's fine to say, can I just have a look at my notes when you're in an interview? It looks like you are really considering what you want to answer, and if you want to take a pause and a breather, that's absolutely fine. Um, it just shows that you're really serious about the situation and you want to answer in the best possible way. Whilst you're in your interview, do make sure you turn off your phone. Don't slouch or look sloppy. Do make eye contact. And do make sure you listen and don't interrupt them as well. And the most important thing really is have fun, smile, and enjoy it. Hopefully, you won't be going through many job interviews in your life. So, it's a well, hopefully not once in a lifetime, but you will, you just want to try and enjoy it and try and get the most out of it and try and learn as much as you can from your future employee. That's all I've got to say really about job interviews. Thank you very, very much for your time, everybody. What I'll do is we'll go and move on to any questions that you've got. I've opened the question panel, so if anyone wants to put any questions on the side panel on the right-hand side, please do, and I'll open up the team so they can answer any questions that anybody's got. Can't see anything coming through yet, but I'll give it a few minutes and see if anyone's got any questions. So I'll say, Kerry, looks like you've got your hand raised. Kerry, do you want to put a question? Oh, here we go. I think I can see a question here. So Rosanna has got a question. So she's got a question. Anyone? So Chris, Hastings, do you want to answer this question? So Rosanna's got a question about is it okay? Oh, hold on 1 minute. It's disappeared off my screen. Is it okay to ask about salary at an interview? What's the best way to go about it? Just 1 minute, Chris, while I unmute you. Right, you ready to go, Chris?
Hi there, Alice. Yeah, it's absolutely fine to kind of discuss that at interview stage. I'd certainly leave it towards the end of the interview. However, most new graduates nowadays, obviously going on to new graduate schemes, salaries are usually set within certain parameters. So it will always be there or thereabouts from one practice to the other. It just also depends on location and kind of the size of the practices and hours. But as I said, most salaries are usually similar now as part of new graduate schemes. But of course, it's always best to ask that to know kind of what you would be expecting and what you'd be looking for.
That's super stuff. Thank you, Chris. I can't see any more questions from anybody. I can't see any more questions from everyone. So, I mean, if no one has got any more questions. Oh, I think there might be another question here from Janice. So Janice has asked, I would like to know if it's okay to reschedule an interview call or interview meeting if a particular time or date does not work for you. So, are you all right answering that one, Gemma? Yeah, you're
Hi there, Janice. Yep, can you hear me? Yep.
Yep.
I would say once you've got it booked in, just be sure prior to booking that in, it should be a two-way thing really. They shouldn't sort of be saying this is when we can interview you and that's all, and you have to sort of drop everything and move around it. It needs to be a little bit of shuffle either way, and generally practices are really open to even more unusual times of interview. Certainly around vets who are already working. For example, we have vets that interview sometimes on early Saturday morning. Sometimes practices remain open after hours to interview somebody. But certainly in the case of a new graduate, if they say a time that you can't make, it's completely fine to say, actually, I can't. I've got some really important EMS that day. I really don't want to miss it. Could we look at another time? But I would try as much as possible. Obviously, sometimes things crop up and you absolutely have to move things. But I would try as much as possible to book it in when you know that you'll be free. And don't be afraid to say that you maybe not, and could we do an hour earlier? That's what I would say.
Super stuff. Thank you, Gemma. Jelly says thank you too on the question pane. So thank
Welcome.
you, Gemma. That's it. It doesn't look like there's any other questions. If anyone's got any last ditch questions to ask, give you another 30 seconds or so. No, okay. Well, thank you very, very much, everyone, for your time. As said, this it has been recorded, and it will go out to everybody, and it will go out to everyone who couldn't attend as well. So thank you very much, and I'll stop the webinar now. So thanks for your time very much.